Welcome. My name is Cheree. Behind every breast cancer statistic is a human story, a mother, a sister, a friend. Today I want to unpack what this diagnosis really means, looking past the fear to explore its biological causes, why its impact extends far beyond one person's body, and how we can push the boundaries of prevention. But first, why breast cancer? Well, beyond the alarming statistics, this topic is deeply personal. I've seen its ripple effect on loved ones. As women, we routinely put our own health on the back burner to care for others. My goal today is to encourage clear awareness, regular checks, to empower us to prioritize our own well-being. And while my focus is primarily on women, it's vital to note that breast cancer also occurs in men, though the cases are rare. So what is breast cancer? It begins when abnormal cells multiply uncontrollably to form a tumor, most commonly starting in the epithelial cells lining the ducts or lobules. Pathophysiologically, gene mutations, hormones, and microenvironmental changes cause normal cells to lose their regulatory mechanisms. This damaged DNA fails to trigger cell repair or death, allowing these abnormal cells to divide exponentially. Hormones like estrogen further drive tumor growth. Over time, these cells can progress from non-invasive, where the abnormal cells remain safely contained within the milk duct, for example, to invasive breast cancer, which penetrates the surrounding tissue and can even metastasize to distant organs like the lymph nodes, bones, liver, lungs, etc. Key warning signs include new lumps, breast shape and changes, nipple discharge, skin redness, or unusual pain. The impact of this disease is vast. On an individual level, diagnoses are often followed and found in routine checks, bringing sudden emotional shock. Exhausting treatments like chemotherapy, radiation, and surgery do work well, but are very taxing on the body, bringing many side effects and placing strain on the family. Locally, this drives a critical demand for accessible, high-quality cancer care centres local to patients. Nationally, it places a heavy financial burden on healthcare budgets for subsidised treatments and screening programs, as well as raising public awareness and improving access for all citizens. Globally, breast cancer is the most common female cancer. While wealthier nations have seen death rates drop through early detection, low-resource nations face rising rates due to limited access to care. The World Health Organization, in partnership with world governments, are working towards lowering the statistic yearly by helping countries adopt and implement the global screening and treatment guidelines. Within the global health guidelines, early detection through screening, awareness, and self-checks remains our most effective line of defense. While we can't change our genetics and mutations like BCRA1 or 2, our age or hormonal history like age of first menses or pregnancy, by identifying these non-modifiable risks, it does help us pinpoint who needs earlier screening. There are lifestyle choices we can adapt to lower or modify our risk. While factors like alcohol intake, smoking, and obesity increase risk, protective habits like increased physical activity, lowering stress, and improved dietary consumption all make a difference. Recent evidence by Poccarel and colleagues in 2024 even suggests that minor dietary shifts, such as increasing dietary protein by just 5 grams a day, can positively influence disease progression. To advance prevention, we must explore new supportive strategies. I propose investigating manual lymphatic drainage, a technique widely used in post-cancer lymphedema management, to see if its ability to enhance blood flow and cellular waste removal could also serve as a preventative measure. My future research question is, among women at elevated risk for primary breast cancer, does adding regular manual lymphatic drainage to standard risk reduction strategies reduce lifetime breast cancer incidence, compared with standard risk reduction strategies alone. In this fight, our goal isn't spreading fear, but cultivating clarity. We already know that small, consistent actions matter: breast awareness, early detection, and the everyday choices that support long-term risk reduction. These efforts don't just change statistics, they save lives. So let's put ourselves back on the priority list. It's how we protect our future and keep showing up for those we love. Thank you.